Hi guys. So today we'll discuss about the cystosomes, and as you know, the cystosomes are what? I will just tell you in a brief regarding them first. Cystosomes are what? These fellows are trematodes. You know that? Okay, these are trematodes, and trematodes. Another name is what, guys? They are also termed as what? Flukes. So trematodes or flukes. They are termed as these fellows, and cystosomes, they go in somewhat exception to the general rule of trematodes. And what are those exceptions? These particular fellows are dioecious. Okay, first thing, they have a separate male and female. Another thing for them is that you need to remember is infective form. The infective form for the cystosomes is Cercaria. Okay, that is the infective form for that. Cercaria also they call it. Okay, the infective form for this particular one is this. They are dioecious. Besides this, you need to remember that they have only a single intermediate host. Okay, only one intermediate host is there. Which one? That is the snail. Snail is the intermediate host here. They are dioecious. They have an infective form what? Cercaria, and this particular like intermediate host is only one. That is the snail. Okay, so these are the important like entities of these particular cystosomes. And the disease they cause is schistosomiasis, which is also termed as, which can come in exam, that is termed as bilharziasis. And guys, it have already come, and the typical language of the question can be like a Brazilian farmer. So it's a South American disease. Presents to the medical clinic with hepatosplenomegaly, and this was a question in AIMS with ascitic fluid in the peritoneal cavity. His liver is studied with white granulomas. So white granulomas is seen in the infection of what? Cystosomes. Okay. Now, which particular cystosomes? Because in this particular question, you are seeing up all the options they are having, all these trematodes only, and of them, three fellows are there which are belonging to the cystosomes. So how to catch up that particular point, that which is the answer. Which of the following organism is endemic in Africa and South or Central America, which is that question, Brazilian one, and it is transmitted by skin penetration. So what penetrates up? That particular Cercaria. Okay, and having a particular egg with a large lateral spine. This is important word. This is what you need to remember here, resulting in what? Dermatitis and Katayama fever. These two names. Obviously, what is Katayama fever? A serum sickness-like syndrome with fever, lymphadenopathy, and hepatosplenomegaly. Okay, guys. Now, what is the answer of it? Is it Chlorella sinensis? Is it Schistosoma hematobium? It is Japanicum or Mansoni? The answer to this question is Mansoni. Why? Because Mansoni is having a lateral spine, which is the hint here. Okay, but two important aspects you need to remember here, that it leads to this dermatitis, which is also termed as cercarial dermatitis, and it also leads to a fever termed as what? Katayama fever. Okay, which is actually what? Serum sickness like syndrome. Okay, guys. Now, this picture is very, very important. Definitely a question is coming out of it. Mansoni, lateral spine, hematobium, terminal spine. Japanicum is having what? A lateral knob, which is not observed in this particular picture. So lateral knob means a rudimentary spine. Okay, rudimentary spine or lateral knob. Now, I would like to tell you some more important points regarding these particular fellows. Okay. Now, as you can see up in the options, there were like Chlorella sinensis also in the option. So those particular fellows, you should know what are the features of them also, what they can cause. Okay, so mainly this Chlorella sinensis leads to what? Upper abdominal pain, and it can cause this biliary tract fibrosis. You know, na guys, the Chlorella sinensis is also termed as a Chinese liver fluke or Oriental liver fluke, and it leads to a particular type of carcinoma also termed as what? Cholangiocarcinoma, and which is a famous question of surgery, that which particular worm leads to this cholangiocarcinoma, bile duct carcinoma. It can also lead to biliary tract fibrosis, this Chlorella one. Okay, this is also what? This is also a trematode fluke, but different from the cystosomes for sure. Then another important fluke is Paragonymous westermanni, which leads to this particular disease that is known as Paragonymiosis, which is characterized by what? Cough, often bloody sputum, and pneumonia. Another all India question of yesteryears. Okay, So paragonal Westermanni, which is also termed as lung fluke, associates with eating of what? The crab and all. Okay, crab or even the fish. Okay, this particular thing is being eaten up here, and it can lead to this cough, that is with bloody sputum and pneumonia. That is this particular disease caused by this paragonymous Westermanni, which is also termed as what? Lung fluke. And guys, this was also asked in one of the FMG exam, that what is the drug of choice for all these trematodes? The answer is praziquantel. Praziquantel is the drug of choice for most of the flukes. And flukes, another name is what? Trematodes. Okay, guys. So these all things you need to remember. But if they're talking about what? If they're talking about these all features which are just seen, hepatosplenomegaly,